Hi, I'm Dr. Andre Jones with Inspire Dental, and I'm here today to talk about dental hygiene. And in this video, we're going to answer the most common questions that are asked regarding dental hygiene, and also what you can expect when you come into my office and see what your dental hygienist will provide you. So the question we most commonly get asked is, what is proper dental hygiene? So proper dental hygiene is when your gums, your teeth are healthy because you've been doing a really good job of cleaning at home, brushing, flossing, and then also going to your dentist for your regular checkups, regular cleanings, and getting your teeth clean. And so proper dental hygiene at home would look like brushing at least twice a day, flossing or water picking once, and then using, a variety of types of toothpaste, mouth rinses, lozenges, mints, different types of gums, things like that. All those things can also help keep your home hygiene in perfect condition. And then when you come to the dentist, we're going to do a gum measurement. And during our gum measurement and assessment, we're going to see, how healthy are your gums? What we are wanting to see as we measure around the teeth is we want to see that our measurements are very shallow. So we're looking at 3 millimeters or less is considered healthy. Anything greater than that means that disease is starting to form. So those are a few things that are involved in proper dental hygiene. So what will happen if we don't practice good dental hygiene? Well, the first step is if we don't practice good dental hygiene at home, what we'll start to notice is that we get this sticky white stuff that forms around our tooth and then our gums. That sticky white stuff is called plaque. Plaque is formed of billions of itty bitty little tiny bacteria. And that bacteria, when it all gathers together, like I said, it sticks to the teeth. It likes to hang out around the gums, and it will start to cause a red irritation to form around your gums. We want gums to look pink. And like I said, this is going to turn red. It's going to make our gums swollen. And eventually our gums are going to peel away from the tooth. And so when our gums peel away, they become very loose, which means stuff can go under the gums. And that sticky white plaque will eventually make its way down to the bone. It starts to harden, and it forms what's called tartar. And when it forms tartar, it releases out toxic enzymes. And those toxic enzymes will actually start to eat away at the bone, and you start to lose bone around your teeth. Well, you keep it that way long enough, and eventually you'll lose all your teeth. The number one cause of tooth loss in the world is due to gum disease. And so that's what will happen when someone has, bad dental hygiene. So what do we do if we, have bad dental hygiene, or if we just want to keep up with our good dental hygiene? Well, you would come to my office, and I would partner you up with someone called a dental hygienist. A dental hygienist is someone who is going to help keep your teeth healthy and clean, along with your gums as well. So what you can expect with part of your exam with a dental hygienist is that she's going to start off with maybe some x-rays. She's going to go in and she's going to look at your teeth, and she's going to make sure that things are looking good with your teeth. She's going to make sure that things are looking good with your gums. She's going to do a gum assessment where she goes around and measures the gums, measures if there's recession, if they bleed, if there's any infections. She's going to measure all of those things. She's also going to look at your tongue, your throat, your cheeks, your neck, anywhere that there could possibly be any type of cancer. She's going to check all those things as well. And that way, she's making sure that you are at the best possible health that you can be at. And once every so often, she may even take an impression if needed. Now, most importantly, when she does this full assessment, your dental hygienist and the doctor, me, Dr. Jones, are going to help determine what is the right type of cleaning for your teeth. And so when we determine the right type of cleaning, your dental hygienist will also then execute the cleaning that you need. And so that's what you can expect to receive from a dental hygienist. So many people wonder, what is involved in a dental cleaning? So once we've completed the right gum assessment, we're going to go in and we're going to clean around your teeth. So the first step is we're going to use an instrument, and this instrument vibrates. And it shoots out water as it vibrates. And what that does is, because that sticky white plaque and that tartar that hardens, it's really hard to get off. So that tool that vibrates, it actually breaks it apart. It breaks it apart as it vibrates around, and also that water helps flushes it and wash it away. And so that's called a cavitron. So the hygienist is going to use a cavitron, and then once she removes all the plaque and tartar, she's going to go through with some floss. And then she's also going to do something to polish your teeth, because we want your teeth to be nice, sparkly white, and it's nice and smooth when you run your tongue across your teeth. So she's going to use a polisher around your teeth to remove any stains and remove any rough spots. And then once that's all complete, and that pretty much sums up your cleaning. Now, if you need a deep cleaning, it's going to pretty much be the same steps, but instead we're going to have to numb the areas that require a deep cleaning. The hygienist is going to use that vibrating tool to go under your gums where it's deep and clean out anything that's unhealthy out under those gums. And so that's kind of the different things that you can expect in a dental cleaning. So people want to know, what type of tools do dental hygienists use? And so I kind of already covered one. I said it was Cavitron. So the Cavitron is the vibrating device that also shoots out water. There's another thing that's very similar, and that's called a piezo, and it works almost the same way. And so those are going to be tools that really help us remove the bulk of what's going on. But then we have some tools that we use by hand, and they're called scalers. And so what we'll do is, after we've scaled away and removed the big stuff, we're going to go in and we're going to do some fine scaling by hand, because by hand we can really feel, and if we feel anything that's rough, we're going to smooth it, clean it away. And so we're going to use those scalers by hand. Then once that is done, we'll go through and we'll use a really skinny little instrument to help feel, make sure there's nothing rough at all, that everything's nice and smooth. Then we're going to go back in with some floss, some polishers to buff up the teeth, make them nice and shiny, remove any stain, and further, smooth out anything that could be rough. And there's also, the air water ejector that we use. We use suction, a mirror. Those are all different types of tools that we use in a dental hygiene appointment. So a lot of times what people get scared about is they worry that their dental hygiene cleaning is going to hurt. In my practice, we do everything we can to make sure you are comfortable. So we have special numbing gels and different things that we can do to help, numb the gums up if it is uncomfortable, if there's sensitivity. We have even some toothpaste that if your teeth are just sensitive to cold or to water, we even have things that we can put on the teeth to help even prevent that sensitivity. So your dental cleaning should not hurt. And our goal is to make sure it does not hurt. So there's a number of things that we can offer you to make this a painless and comfortable process. A question that people should ask themselves, and a lot of people don't even know the answer of, is how long should dental cleaning take? Well, a proper dental cleaning, if done correctly, takes at least an hour to complete. All the way from, for all the different steps that need to be done to the doctor checking, it really should be an hour long for a proper job to be done. So in my practice, that's what we schedule for a regular type of cleaning or a maintenance type of cleaning. For a deep cleaning will usually take double that amount of time. It'll probably take about 2 hours for it to be done properly. The reason why I say properly is what is very popular nowadays, and what you'll see in a lot of offices, is that they do cleans in 20 minutes. There is no way a proper teeth cleaning can be done in 20 minutes. And so that's why I say it's very important to know, that way you know what to expect and can take in control of your health, and you can choose a dentist that does it the proper way. Same thing for a deep cleaning. There are a lot of places that are going to do it in an hour. The thought behind it is, well, you, the patient, you don't know. You just think that's just how it goes, and you don't realize what's being left behind. And what happens is, because it's being done so quickly, stuff is being left behind. If stuff is being left behind, well, you're going to get more disease. The more disease you get, that means the more treatment you need. And then the cycle just continues until your disease becomes so bad that now you have to go see a specialist or someone like me to try to reverse your disease. And so that's why it's so important to know that a good dental hygienist is going to spend about an hour and for a regular cleaning or a maintenance, and then 2 hours on like a deep cleaning. We've talked about regular cleanings, deep cleanings. So oftentimes people don't always know or wonder, why is a deep cleaning necessary? And like I mentioned, so a deep cleaning is necessary because now the gums have detached from the tooth. The gums are loose. Stuff has gone under the gums. If I take my tool and just go under the gums to clean out, well, it's going to be really painful. So we get your mouth numb. And once your mouth is numb and the gums are numb, now we can go in and we can take our tools and clean it out. And the reason why it's necessary is if we leave that stuff under the gums, that's going to cause more and more bone loss over time. And the number one reason why people lose their teeth is because it's gum disease that causes bone disease. And so we don't want that for you. And so that's why we're going to do a deep cleaning to remove that, what is going to be causing your gum disease. That way your bone and gum tissues can be healed back to the tooth and be healthy once again. Once you have your dental cleaning, people want to know, well, what's the next step? What is necessary for me to do? And so the next steps are going to be maintenance, hygiene at home. And so making sure you're brushing at least twice a day, flossing or water picking once a day. There's also different types of toothbrushes that are more effective at cleaning your teeth. So any type of electric toothbrush is going to be better than a manual toothbrush. Also, there's different types of toothpaste and different types of mints, gums, mouth rinses that can also be used to help, kill the bacteria in your mouth and help only what's healthy be there. And so all those things are going to be like necessary steps to take after you've had your cleaning. So the best way to schedule a dental appointment is to call our office at 210-734-5092. Or you can go to our website and request an appointment. You can even check us out on Facebook and also request an appointment through there. So lots of different ways that we can get you in to schedule your dental hygiene appointment. Thank you for your attention. I hope this video was very informative and helpful to you. We are passionate about education and answering any questions that you may have and empowering you to take control of your health. That's what matters most. So if you would like more information or like to schedule an appointment with us, please check us out on our website at inspiredentalsa.com. There'll be a link provided. Also, you can call our office at 210-734-5092. I look forward to seeing you and taking care of you. Thank you for your time. Dr. Jones, signing out.